Hello and welcome to our YouTube channel. Today, we will be discussing 15 treatments for Bell's palsy, a condition that affects the facial nerve and can cause paralysis on one side of the face. 1. Corticosteroids. These medications, such as prednisone, can help reduce inflammation in the facial nerve and improve recovery. 2. Antiviral medications. If the cause of Bell's palsy is believed to be a viral infection, such as herpes simplex, antiviral medications may be prescribed. 3. Physical therapy. Facial exercises and massage can help improve muscle strength and function in the affected side of the face. 4. Acupuncture. This traditional Chinese medicine treatment involves inserting needles into specific points on the body to stimulate healing and improve function. 5. Transcutaneous electrical nerve stimulation, TENS. This treatment involves using low-voltage electrical currents to stimulate the muscles of the face. 6. Hot and cold compresses. Applying heat or cold to the affected side of the face may help reduce pain and improve facial muscle function. 7. Placing a patch over the eye. This can help protect the eye from drying out and reduce the risk of complications. 8. Botox injections. These injections can help relax the muscles of the affected side of the face and improve symmetry. 9. Facial prosthetics. In severe cases of Bell's palsy, a prosthetic device may be used to restore facial symmetry and improve function. 10. Surgery. In rare cases, surgery may be necessary to repair damaged facial nerves or remove scar tissue that is preventing proper nerve function. 11. Hyperbaric oxygen therapy. This treatment involves breathing in pure oxygen in a pressurized chamber, which can help improve blood flow to the facial nerve and speed up recovery. 12. Chiropractic care. Chiropractic adjustments may help improve nerve function and reduce inflammation. 13. Massage. Massaging the muscles of the affected side of the face can help improve blood flow and reduce muscle tension. 14. Nutritional supplements. Some people with Bell's palsy may benefit from taking supplements such as vitamin B12 or omega-3 fatty acids to support nerve health. 15. Supportive care. Getting plenty of rest, eating a healthy diet, and avoiding situations that may stress or irritate the affected side of the face can all be helpful in the recovery process. It's important to note that treatment for Bell's palsy should be tailored to the individual, and the best course of action will depend on the severity of the condition and the underlying cause. If you or someone you know is experiencing symptoms of Bell's palsy, it's important to see a healthcare provider for a proper diagnosis and treatment plan. Take care and thank you for watching. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more informative videos.